These results obviously should translate to the US, where the same surgery is performed quite a bit. Have you noticed, Dr. Makary, have surgery rates dropped here in the US?
Well, by and large, they have not as a result of these placebo-based trials. So ironically, we're putting patients through surgery they don't need for the sake of generating science and evidence. But once we generate it, the practice has by and large been unchanged. Take, for example, the knee arthroscopy procedure that's very common called a meniscectomy. That procedure has zero benefit. They've done the placebo-based trial, no benefit. And yet, today in the United States, we do 750,000 a year. It is one of the most common orthopedic procedures in the United States, despite the hard evidence that it does not work in the vast majority of indications, which
Dr.
are
Marty, on
99%
top
of the
of
time.
that arthroscopy can cause significant harm. It happened to me. I ended up getting a knee replacement because somebody said, oh, we're gonna do a scope, nothing. We're gonna clean up your meniscus. We're gonna rotor-rooter your joint space. Well, guess what? Lost the cartilage, ended up with a knee replacement that in my mind, I don't think I would have needed if I hadn't had that scope in the first place.
And Dr. Makary, to that point, it takes 17 years on average for the evidence base, for these scientific studies to actually start to impact the daily practices of providers. So what's your opinion on that? And what can we do to close that gap?
Look, these randomized control placebo trials were really designed for drugs. They were designed to look at placebo medications. Unfortunately, some doctors feel like we have to do this in order to change their practice. They're done. I'm not saying it's unethical. I'm saying, look, it's really pushing the envelope of ethics. But even when we get the studies in the United States, we're not seeing a change in practice. We're seeing a 17-year lag time. That is a tragedy.
What needs to change so that people aren't getting surgeries they don't need?
I've had doctors tell me, look, Marty, what do you want me to do to tell a patient who has knee pain? Do you want me to tell them just to live with it and offer them nothing? And I say, yes, if the surgery doesn't work, you tell them I'm not going to do surgery. You know that there's doctors out there where this median meniscectomy arthroscopy surgery that's been shown to have no benefit 99% of the time is 100% of their practice. Okay, if it's 100% of your practice, that is a practice pattern that is an outlier. Right. If a doctor tells you as a patient that a pain that you've been living with for years needs surgery, and let's do it in a day or tomorrow or the next day or within 3 days, that is a warning that that surgeon is most likely to be doing unnecessary surgery. Run for your life if a surgeon wants to do surgery on something that you've been living with for years the next day or within 3 days.
Now, Dr. Carr, before I let you go, I want to ask, you mentioned the surgery rate dropped from 30,000 to 3,000. That is a massive drop. And maybe those 3,000 cases were all justified because, again, there are always going to be unique cases where you might need to perform these surgeries. Why did the rate drop so drastically in the UK when it hasn't dropped at all in the US?
I mean, this to me is a really crucial point. If we take the trouble to generate high quality evidence, we must ensure when that evidence appears that it's adopted into practice.
Right.
So first and foremost, we'd involved patients throughout the study. We had strong patient advocates. Patients went out and spoke to other patients. Number two, we involved all of the shoulder surgeons in the United Kingdom in this study. So what was remarkable in this study is that we'd actually begun to change the rate of surgery just by doing the trial.
Wow.
Even before we'd published the results, we'd made people sit and think, well, am I really doing the right thing with this operation? So we'd actually changed practice before we produced the results. Then the moment we produced the results, we spoke with the surgeons, we spoke with the patients, and we spoke with the payers of healthcare in the United Kingdom, the National Health Service. And those groups together, all working together, I think is what resulted in such rapid adoption of the new evidence.